Relative Afferent Pupillary Defect, Part 1. What will be covered in this video? What is RAPD? Normal afferent pathway. Kestenbaum's alternate cover test. Swinging flashlight test. Swinging flashlight test in special situations. What is RAPD? aka Marcus gun pupil. The term describes the nature of the pupillary abnormality. It is a paradoxical response of a pupil to light in the presence of a relative afferent pathway defect. Causes: incomplete optic nerve disease, severe retinal disease. Why is it a paradox? The pupil appears to be dilating when the light is directed on it. When the light is shown on one eye, light impulses from the retina travel to the optic nerve. From the optic nerve, the fibers travel to the chasma where the nasal fibers decussate and travel to the contralateral optic tract to terminate in the contralateral pretectal nucleus. While the temporal fibers, uncrossed, travel to the ipsilateral optic tract to terminate in the ipsilateral pretectal nucleus. The internuncial fibers connect each pretectal nucleus to the Edinger-Westphal nucleus. Kestenbaum's alternate cover test. Not performed nowadays, and is now refined by swinging flashlight test. For example, in left optic nerve disease, when the affected eye is covered, there is no pupillary response in the uncovered eye. When the normal right eye is covered and the affected left eye is uncovered, the left pupil dilates. When you alternate and cover the affected left eye, the uncovered normal right eye constricts. When you alternate again and cover the normal right eye, uncovering the affected left eye, the left pupil dilates. The more the afferent pupillary defect, the more dilated the pupil will be. This is the Kestenbaum's alternate cover test. Coming to the swinging flashlight test. This is the most valuable clinical test for optic nerve dysfunction. How is the test done? The patient is asked to focus on a distant object. This is done to prevent miosis that occurs in the near response. Then, the torch light is swung back and forth multiple times. The light should remain equally on each eye for 3 to 5 seconds to allow pupillary stabilization. If the optic nerve and retina is normal, both pupils will constrict in this test. The swinging flashlight test in RAPD. In case of the left optic nerve disease, when the light is shown on the right pupil, both pupils constrict. When the light is shown on the left pupil, both pupils dilate, due to an afferent pathway defect. Swinging the light back to the right pupil, both pupils constrict. This is explained by the consensual light reflex. This method helps us detect any relative sluggishness of the pupillary reflex or paradoxical dilatation of the illuminated eye. The swinging flashlight test in special situations. When you have only one normal pupil to test and the other pupil cannot be assessed due to sphincter damage, efferent defect in third nerve palsy, and in case of poor visualization of pupil in corneal opacity. So, how do we look for RAPD in these situations? We can use a second light source which is dim for examining the normal pupil when the swinging flashlight test is performed. When we have a left optic nerve disease with sphincter damage in the same eye, using a second torch with dim light will help us notice the changes on the normal pupil. First, shining the light on the normal right eye, constriction will be seen. Then swinging the light to the left eye, dilatation will be observed in the right pupil. Swinging the light back to the right eye again, constriction will be seen. The same will be observed with left eye optic nerve disease with third nerve palsy in the same eye. Similarly, with left eye optic nerve disease and corneal opacity in the same eye. Thank you for watching this video. We will cover part 2 in the next video. Subscribe to this channel for more.